students, teachers, Professor Varro, Professor Peter Hagee, Professor Balash, Professor Mercury, deans, professors, ladies and gentlemen. Thank you for this incredible invitation to myself and my colleagues from Singapore to visit Hungary. This is my first time, and I believe it's the first time for many of my colleagues. And you know, what is so striking to me visiting Hungary, firstly, it's as beautiful as I always knew it was going to be. When I was growing up, one of my heroes was Ignaz Semmelweis when I was a teenager. You know, to actually be in Hungary. But actually what strikes me most about Hungary is the optimism that I see in this country. And it's not very often that I see this level of optimism. It's so refreshing. And you know, you've got an incredible heritage and DNA, and you combine that heritage, that DNA, with optimism, and really the world is yours. So I'm going to change gears, and you know, I'm not going to show you my life history as Professor Kobilka did, but I did when I was a high school student. I was deciding what to do for my career. And when my school counselor asked me what I wanted to do, I said, well, either I wanted to become a teacher, a historian, a priest, or a doctor. And actually, I ended up doing medicine because I thought it could combine 1, 2, and 3. You know, you can teach. I mean, medicine is all about learning about stories. And of course, you know, you comfort, and I thought that medicine would summarize and encapsulate all of that. I started my life off as wanting, you know, I'm a hematologist, medical oncologist. I treat cancer patients. I was very involved in drug development. I started the cancer center at the university. I then was dean of the medical school, and then I ended up leading a healthcare system. And now I'm spending my time looking at the other historic change. And let me share with everyone that I'm not so sure whether the world is aware that there are 2 changes going on that humankind, has never experienced ever. One is climate change. The world has never, humanity, Homo sapien, has never experienced a world where the temperature is going to exceed probably 2 degrees centigrade. But we can all feel it. But there's another historic change occurring, and I'd like to spend the next 30 minutes or so just talking about that other historic change, because I think it needs to be given as much attention as climate change. And this is, let me just share with you, I come from Singapore. Some of you may not have been to Singapore. Singapore is tiny. You know, I come to Hungary and everyone says Hungary is a small country. Singapore is a tiny city-state. You know, people say it takes 3 hours to go from east to west. In Singapore, it takes about 35 minutes to go from, maybe 40 minutes with traffic. To go from east to west is 40 minutes, and it's 30 minutes to go from north to south. So we are a tiny, tiny city-state. 5.9 million people. 3 major ethnic groups, the Chinese, the Malay, and the Indians. We have more people going through our airport than there are living in the country. But Singapore, within 6 to 7 hours flying time, covers most of Asia and a big part of Central Asia. But when Singapore was first developing, this was the Singapore that I grew up in. When I was growing up in Singapore, children were still bathing in the streets. You could not drink tap water. There were cholera outbreaks. Unemployment was about 20%. So this is part of Singapore. It's known as the Kallang Basin. It smelled so bad. I remember, whenever my father used to go for a drive, I would hope that he would not drive close to this place. This is Singapore now, exactly the same place. Exactly the same place, and it's a big tourist destination now. But what's amazing is that they've managed to convert a big part of the sea into a freshwater lake, and the otters have come back to Singapore. So there are now otters running around the streets of Singapore. Some people think it's very cute, but this is what has happened in my lifetime. And I show this because change is always happening. And I think the question is, how can we make sure that change is for the better? So this is a comparison of Singapore and Hungary, both investing a tremendous amount in education. Hungary already, I just want to point out, 21% of Hungary is already over 65. And we'll come back to that figure. Now, one of the biggest miracles of the 20th century has been this incredible increase in lifespan. Lifespan for the first, 100,000 years of Homo sapiens existence, until the 1900s, probably until the 1800s, lifespan was probably about 25, 30. In 1900, lifespan was 47. But between 1900 and 2024, Hungary has added an extra 30 years of lifespan. Singapore, a little bit more. So this explosion in lifespan over the last 100 years has been must be one of the greatest miracles of the 20th century. The question is, have we made use? Have we benefited from this miracle? Because what has happened at the same time is that fertility rates around the world have dropped by 50%. Now, there are many reasons why fertility rate has dropped around the world, but currently two-thirds of the world is now below replacement rate. Now, what does that mean? Some people will say, well, maybe that's going to be more sustainable. But when two-thirds of the world is below replacement rate, what has happened is that there are now more people over 65 than under 5 in the whole world. In 2019, the curves crossed. So Hungary now has more people over 65 than under 5, and in my country, Singapore, again, we have more people over 65 than under 5. The United Nations called the world's attention to this in 2017, saying virtually every country is experiencing growth in the number and proportion of older persons in the population, and that population aging is poised to be one of the most significant social transformations of the 21st century, with implications for nearly all sections of society, and we need to be prepared for it. We need to prepare for this as much as we prepare for climate change. Now, what is happening is that, this is, the alignment is a bit off, but in 20 years' time, in 25 years' time, which is roughly the same time as 1989 when the Berlin Wall came down until now, it's roughly the same time as 9/11 to now. In that same time frame, nearly every third person in Hungary is going to be over 60. In my country, nearly every other person is going to be over 60. 6 of the 10 most aged countries in the world are in Europe. So it's going to be a very different world. So the question is, can we enjoy being old? Why are we so worried about this? And my answer is, yes, we can enjoy being old, because to me, this is one of the most remarkable persons. I've never met him before, but this is Marcel Remy. At the age of 98, he could do rock climbing. He passed away at 99, but this is the kind of life that I would like to lead, where I can be doing rock climbing. I can't rock climb, but if I could, I wish I could. But to be rock climbing at 98 and literally rock climbing till weeks before he passed away. This is the life that we should be aiming for. A life where we can do anything and everything we want to do, and when the end comes, it's a good death. So how do we get there? How do we get to a life of healthy longevity? I think it's very important for us to go back and look at the definition of health. Now, I'm embarrassed to say I'm a practicing doctor, but it wasn't until the last 20 years or so that I realized, that health, again, the WHO definition of health is that it must encompass physical, mental, and social well-being. Now, we spend a lot of time talking about physical well-being. What's your blood pressure? What's your cholesterol? What's your blood sugar? Have you gone for cancer screening? That's physical health. In the last 10 to 15 years, we're paying more attention to mental health. That's long overdue. But are we paying enough attention to social well-being? And I dare say that we have not invested enough in social well-being as we have in mental and physical well-being. And healthy longevity is the state in which the years in good health approach the biological lifespan with physical, cognitive, and social functioning. Social functioning, what is social functioning? Well, it's social networks, it's friends. One of the biggest challenges, in fact, the United States Surgeon General raised the alarm, is loneliness. Loneliness impacts, once someone is lonely, it's equivalent to smoking 15 cigarettes a day. And it's not just older people who are feeling lonely, it's younger people also. So we really have to look at social functioning. And it's really important to preserve health for all, across all ages, even into older age. So do we have healthy longevity? This is lifespan in Singapore and in Hungary, and this is health-adjusted life expectancy. So in nearly every country in the world, the last 10, 11 years of life is spent in poor health. And the question is, can we afford that? How can we afford that? How can we look forward to our older age and benefit from the great advances of the 20th century, where we were given 20 extra years of life if we don't enjoy and make the most of it? Look at, this is Hungary's current landscape. In 2019, 1/3 of Hungarian men smoke, 20% of women. What's worrisome is that 1/3 of 15-year-olds are smoking. Alcohol, the incidence of alcohol consumption is significant. Obesity rising. This is not just a Hungarian issue. In Singapore, the same thing is happening. The incidence of drinking has doubled. Binge drinking has doubled. We've been lucky. Smoking in Singapore has been relatively well controlled. In fact, we're very glad that the number of young smokers has dropped by half. But obesity is going up, and these are issues we need to address. What about mental health? Again, a big problem. In Hungary, about 14%. In Singapore, the prevalence is rising. It's worse in women than in men. But look at the age group that is really going up. It's the people between 18 to 29. It's the fastest rising group of poor mental health. The older people, although the incidence of poor mental health is less than younger people, older people less likely to seek help, less likely to seek treatment. So what can we do? Well, the good news, and this really is good news, is that the evidence is out there that healthy life expectancy can approximate the biological lifespan. There are 2 free documents. You can download this, and all of these slides will be made available to all of you. So the WHO, the Decade of Healthy Aging, so WHO have put out a document in 2019, and I was privileged to co-chair an international commission which put out the document on the left-hand side. It was commissioned by the United States National Academy of Medicine. This came out in 2022. So the evidence is all out there that it is possible to do this. So, if anything, I'd like to leave you with 3 important concepts. The first concept is that health is the outcome of multiple determinants: social determinants, economic determinants, environmental determinants, and structural determinants. And just social determinants alone, there are at least 10 factors that impact on health. And notice that the health system is only one of 10 factors. You need to you need to address income and wealth, you need to address housing, transportation, the social environment, physical safety, physical environment, employment, education, even broadband access. So this was the slide that actually changed the way I approached it. Where I decided maybe I should move out of just seeing more and more cancer patients. And this was the 2007 Shattuck lecture given by Steve Schroeder in 2007. It was published in the New England Journal of Medicine. And basically, when I looked at this, and I said, my goodness, like Professor Kobilka, working 80 to 100 hours a week as a young doctor, I could only shift the needle in 10%. 10% of premature death and premature disability is influenced by the healthcare system. 60% of the factors are in the green zone, are social, behavioral, and environmental. So no matter how hard I work in a hospital, I can only shift the needle in 10%. I need to get out into the green zone where it will impact at least 60%. And so this is a dramatic representation of social determinants of health. In every city, you can predict someone's lifespan by what subway stop they get off at. This is very dramatic. This is Chicago. In Chicago, there is a 16, whether you get off at Washington Heights or whether you get off at the Loop, there's a 16-year difference in lifespan. You can see the same it's not as dramatic in Singapore. There's probably a few years difference, but in every city, you see differences, and these are due to all those 9 other determinants that I mentioned. The second is that health is the outcome of a complex system. Complex systems, again, I'm not an engineer, but systems engineering is really it's a good summary where there are multiple factors influencing a certain phenotype. If you look at obesity, obesity is not just the outcome of the quality and type of food. It's one of the factors, but urban design, the type of job someone has, the amount of physical activity, whether you use public transportation or whether you drive. If the ambient temperature is 40 degrees centigrade outside, you're not going to go for a run. If there's tremendous air pollution, again, you're not going to go outside and exercise. You're not going to go out and exercise if you're going to get robbed or assaulted. So all of these factors affect obesity. And the third factor is that health requires investment across the life course. So you need to have the man and the woman healthy. If the man and woman are healthy, the chances that when they conceive a child, if the mother is healthy during pregnancy, the chances of the baby being born with a good head start is so much better. And this is, again, Singapore has contributed to this research. We have a cohort of 1,200 children who we've been tracking from the time they were conceived. And if the mothers were under significant stress, the babies are born with abnormal amygdalas. The brain of the baby is abnormal already from the first month of life. So it's you have to invest in keeping men and women healthy. We need to invest in the mother's pregnancy to make sure the mother is healthy, in infancy, in adolescence, in early adulthood, in middle age, and older age. If we abuse our bodies for 50 years and then expect the last 30 years to be great, it's more challenging. But the good news is that prevention works at every age and stage of life. That is why we want to vaccinate 80, 90-year-olds against COVID, because prevention helps at every age and stage of life. So those three concepts are the most important concepts that I want to share with you. This is probably the most important diagram that I'd like to share with you, and this is that we can create a virtuous cycle of healthy longevity. So it starts off by society having a strong social compact. A social compact is where the country, its leaders, as well as the citizens get together and say, what do we want in our society? And it needs equity, and it needs social cohesion at the very center. So if everyone agrees that this is the society we want Hungary to be, or this is the society we want Singapore to be, and then we invest in enablers. We invest in good jobs. We invest in building up social capital. We invest in shaping the physical environment. And we invest in health systems. And then we address the disruptors. The biggest disruptor is ageism. And ageism is a very unique bias. You've all heard of racism. You've all heard of sexism. But ageism is the only bias that individuals have against their future self. All of us will get older. And all of us who are older were younger before. So it's really important that people don't define others by their age. And this issue is something we have to, all around the world, the incidence of ageism has increased. It sharply accelerated after COVID. And we need to combat that because it's one of the worst biases society has. We have to address disease, poverty, the social determinants that I mentioned, pollution, climate change, conflict, and inequity. So if we invest in the enablers and we address the disruptors, we can lead to populations with enormous human capital, social capital, and ultimately economic capital. So what is this capital I'm talking about? It's the same, it's even greater than the capital that occurred after the Second World War. Prior to the Second World War, most women were not in the workforce. From the 1950s onwards, women entered the workforce. I look at the audience, at least half the people in this audience are women. And that's why countries are booming, because women have entered the workforce. Can you imagine what would happen if we have people in their 60s, 70s, and 80s remaining, contributing in what they want to do? So it's contributing to society. Of course, when you're 70 or 80, you don't want to be working 100-hour weeks, but you want to be able to contribute, you want to be able to be valued. How can we do this? And there is a return on investment. The United Kingdom has calculated that if they add 1 year of working life in the United Kingdom, it will generate 1.5% GDP over 4 years. In 2019, just before COVID, the paper was published in 2020, but the work was done between 2017 to 2019. A group of American and European economists, led by David Bloom from the Harvard School of Public Health, looked at what is the current economic contribution of people over the age of 60 in the US and in Europe. And the figure, 7.3% of GDP. Now that's enormous. Now, I know when I was in high school, I could not understand GDP. So let me bring you to the third example. The third example is that the United States, and this is a group of economists, again, led by Andrew Scott from the United Kingdom, have looked at what is the impact to the American economy if America could increase health-adjusted life expectancy by 1 year. If America can adjust health-adjusted life expectancy by 1 year, it would generate 37 trillion US dollars. Now, what is 1 trillion? You need to spend $1 million every day for 3,000 years before you can spend 1 trillion. 1 million every day, 3,000 years, 1 trillion. So extending 1 year of health-adjusted life expectancy will generate 37 trillion. And these are the resources that will then drive this virtuous cycle. And that's why it's so important to invest in our people, because our people are our most important capital. It's not oil, it's not gold, it's people. And what Hungary is doing, investing in the youth of Hungary, is the greatest gift that any society can give. But we should also invest in the older members of society also. So let me just, it's not that long-lived populations are the problem. People should not be saying, oh my goodness, there are more people over 65 than under 5. That's not the problem. The problem is that we have not ensured that everyone over 65 is healthy. If we can ensure that everyone is like Marcel Remy, doing rock climbing at 98, we can lead to a resource that has never existed in human history. A society where there are vibrant young people, and there's a society with vibrant older people. And multiple studies have shown that a multi-generational team does better than a unigenerational team. And since this is a conference on science and education, I will just quote you one randomized trial. And that randomized trial was done by Axel Borsch-Supan from the Max Planck Institute in Germany, where he looked at Mercedes. Mercedes make trucks. And to make a Mercedes truck is a big truck, lots of moving parts. And he said, who can make a better truck? A team of people largely in their 30s, maybe some in their early 40s, or a team where there are 30, 40, 50, 60-year-olds. And at the end of 1 year, it was the multi-generational team that made trucks with less defects. Because younger teams, very enthusiastic, lots of energy, but when they ran into problems, didn't know how to problem solve. The multi-generational team benefited from both the energy of younger people as well as older members of the team who said, don't worry, we've seen that problem before, this is what we should do. So this is what society can look like, but it won't happen unless we all work on it, because if it could happen, we wouldn't be so worried as we are now. So thank you very much, and again, I'd like to end with what people are saying should be the new map of life. And the new map of life, this is a model proposed by Laura Carstensen and colleagues at Stanford University. The current map of life was designed when life was 60 years old, when lifespan was 40, 50, 60, where we spend the first 20, 25 years of our life learning. You go to kindergarten, you go to primary school, you go to secondary school, you go to high school, you go to university, and then you start working at 25. And then from 25, you work all the way until you're 65. And then from 65 to 85 or 90, you're wondering, okay, what's next? Why do we need to live our life this way? Why can't we have a blended life whereby, yes, we go to school, go to university. But why can't we go back to university again when we're 40 or 50? We talk about lifelong learning. We talk about lifelong learning, but no OECD university has more than 2% of their students enrolled over the age of 40. So why can't we all work until, say, 30 years old and then take a few years off after 30, take a sabbatical after 30, and then go back to school maybe at 45 and 50 and train again? And why can't we take holidays again, longer holidays throughout our life rather than stacking it all up at the end? So we should be asking ourselves, because our current society was built for lifespans of 45, 47, 50, 60 maybe, not for lifespans of 85, 90. And I think this is what we owe it to each other, and certainly we can do it. So when I was walking in, I saw many quotes, but this quote from Professor Bellamarchi from the rector of Semmelweis, I think is a quote that has stuck in my head, because I think that if we know where we want to go and we have a vision of what that is, you've heard many talks before in the past, I think it can happen. Thank you very much.
So thank you very much, John, for the wonderful presentation, and we would like to provide you the foundation medal and also the certificate. But first, let's ask the audience about some questions.
Do you really think it's possible for humans to reduce their unnecessary needs? So, is it possible? Unnecessary needs. Yes. I have more questions, so I think I will keep standing.
Well, firstly, it's good to have doubts. Okay? It's good to have doubts. I think the question was, is it possible for humans to reduce unnecessary needs? Well, so I am very optimistic that people use seat belts and people use helmets, and I don't know about Hungary, but certainly I've spent a lot of my life in Singapore and in New York, and I've seen smoking culture change so quickly that people don't smoke in restaurants when they used to smoke in restaurants before. People don't smoke in a lecture theater. When I was a medical student, people would be smoking in the lecture theater. So I think that if society thinks that this is something which is good, society values happiness most. And the question is, how do we show people that you can be happy if, let's say, we stop smoking? And how can we show people that you'll be happy if you wear a seatbelt or you wear a helmet? And I think that this is how we should not be telling people you must do this. Now, it does help that, if together society believes that it's not right for young people to be brain damaged because they're not wearing a helmet, or it's not right for so many people to be dying from smoking. So I do believe that it's possible. Now, it's not easy, and that's why, no society, if the United Nations will not be calling the whole world's attention to this if the whole world was heading in the right direction. But I think that Homo sapien is a very adaptable species. And I think that if we know that this is going to be for our good, for our family's good, our parents, our friends, and our future children, I'm optimistic.
All right, thank you for the answer. But I also have another
Please.
comment or question. So you mentioned this multi-generation teams, and actually it has been proven in India, like several decades and 1,000 years ago, that they lived in ways that the homes were made out of multi-generation groups, and
yes.
it works.
Yes.
And thank you for stating it out, because I try to point it out for my teachers that actually it could work, but they didn't really believe me. So you gave me kind of hope in that way, so thank you.
Yes, no, I think that, I mean, we have, you know, sometimes it's worth going back to relook at how societies lived before. When we lived in villages, and it says, you know, it takes the village to raise a child. It's very real. But now family units are much smaller. We live in cities where we sometimes don't know our neighbors. So I think that this, again, calling attention to this, that it's very important to build social networks. And that is why I do believe that we have not emphasized enough in our education and in our societies on social capital and social functioning. I mean, many societies knew about this thousands of years ago, and I think we have forgotten that. And I hate to say this, but again, social media may, unfortunately, have actually made us even more isolated. We're meant to have more friends. You know, you can have 5,000 friends on Facebook, but how many of them will we really turn to in an emergency? How many of them do we know so well that in a crisis we would reach out to them? I don't know. And in the days before we had social media, when we were all staying and we knew our neighbors, maybe things were different then. But it's no point it's no point wishing for the past. I think what we need to do is say, what do we learn? How can we create the future together? And I think it's very, very possible. Thank you.
Thank you very much indeed. Thank you.